Turning now to the fight against COVID-19, we're getting a lot of questions from viewers about the Omicron variant and when the pandemic might eventually end.
And with that in mind, Fox 12's Simon Gutierrez went looking for some insight into that. He joins us live in studio with what we can expect with these COVID-19 variants. Simon.
Yeah, we spoke with Dr. Bill Messer, who heads up the COVID-19 genetic sequencing efforts at OHSU, identifying new variants of the virus when they arrive here in Oregon. We had a lengthy conversation with him about the future of COVID-19 and what it might look like living with the virus for years to come, which seems to be the direction we're headed.
Right now is that we're just going to have to kind of live with COVID-19 for some time, several years, if not forever. Is that kind of your understanding of it too? I've also heard that potentially the virus could keep evolving in such a way that it becomes more like the common cold, so less severe.
Yeah, I mean, both of those are possibilities. They're certainly not mutually exclusive. Like the Austrian president said the other day, we're all going to be vaccinated, recovered, or dead at some point.
A few months into the pandemic, everybody was wondering, when are we going to go back to normal? 2 years later, people are still wondering when we're going to go back to normal. Is there a possibility that we just don't go back to normal, that we have to deal with some of these measures like masking and limiting gatherings and things like that for years?
But the answer that I am beginning to come up with, or have come up with, is it's probably going to be seasonal. And there probably will be times of the year or years where we'll say, oh, COVID transmission is really up in the community, probably time to start wearing masks, probably time to limit indoor gatherings. And then come summer, a lot of those restrictions will probably go away. Southeast Asia, where they see a lot of seasonal influenza, that's not, mask wearing is something that's a lot more common. It was a lot more common before COVID. And it might require us to kind of catch up with that practice, but recognizing seasonality and recognizing risk and being able to flex.
And on the topic of masks, we asked the Oregon Health Authority about when the state's indoor mask mandate might be relaxed, since Oregon is one of just a handful of states that still has one. They said there is no specific metric that would trigger a relaxing of masking guidelines, but that they would need to see both cases and hospitalizations going down more quickly than they currently are. Reporting live in studio, Simon Gutierrez, Fox 12 Oregon.